and I'll turn on my microphone. This morning we will be considering the Pandemic and All Hazards Preparedness and, and Response Act, affectionately within the Beltway called the PAPA Act. Before we get started, let me take a moment to thank the staffs of Senators Casey, Romney, and Ranking Member Cassidy for working closely together to move this legislation forward. Our staffs have worked hard to ensure that this is a bipartisan bill that incorporates priorities for nearly all of our members on both sides of the aisle. As all of you know, and I don't think any of us will ever forget, we have lost over 1 million Americans from COVID, and this terrible pandemic has taken millions in almost every country on earth. And I think it is fair to say that while all of our public health people worked tirelessly and did everything they could to protect the American people, it would be an understatement to say that we were tragically unprepared to respond to that crisis. Months after the pandemic erupted, doctors and nurses lacked the masks, the gloves, the gowns, the equipment they needed to protect themselves and their patients. I think all of us will remember the pictures of nurses with plastic garbage bags in hospitals because they didn't have the proper equipment that they needed. We did not at that time have the tests that we needed to discover who had COVID and who did not. We did not have the infrastructure we needed to deal with the pandemic. All of us remember the overcrowded hospitals, the ICUs from one end of the country to the other that were really overwhelmed with patients. We did not have the vaccines at that time or the treatments that the American people throughout the world desperately needed. And as we learned at a hearing that we held in this committee, what the leading experts in the country are telling us is sadly, tragically, there is a real possibility that another pandemic, perhaps as deadly as COVID, perhaps worse, could occur in the near future. And clearly what our responsibility is to make sure that we are better prepared next time than we were last time. And that is basically what this legislation is about. This legislation will help us make sure that we have a capable workforce in place, not just nurses and doctors, but also public health workers, our disease detectives, who can figure out where an outbreak is happening and set up vaccination clinics, among many other things. This legislation will help make sure that we have accurate public health data to know who is getting sick and where they're getting sick. This legislation will help make sure that we have enough medical supplies, masks, gowns, gloves for our healthcare workers. And let us be clear, this legislation that we are marking up today will not only help us in our efforts to prepare and respond to the next pandemic, it will also help us respond to natural disasters as well as chemical, biological, radiological, and nuclear threats. Under this bill, we will improve data collection for infectious diseases and monitor new pathogens through wastewater surveillance. Under this bill, we will require drug manufacturers to report more information to the FDA about drug shortages so that the federal government can take action more quickly to respond to those shortages. This legislation will require drug manufacturers to notify FDA if there is an increase in demand that they will not be able to meet, which is what we saw with children's Tylenol this winter. I think you'll all probably recall your offices getting many calls about those issues. I'm also pleased that this bill will increase funding to expand the emergency medical services in rural areas. Further, this legislation directs HHS to work with the National Academies of Science, Engineering, and Medicine to study prizes, a transformative new way of paying for the development of prescription drugs. This study would take a serious look at how we can create new treatments and cures without the burdens of monopolies and high prices. As part of this agreement, Ranking Member Cassidy and I have agreed to send a letter to appropriators urging them to fund the price study. Let me conclude by saying I support this bill, and I believe it should be signed into law as soon as possible. Senator Cassidy, you are now recognized for your opening statement.
Thank you, Chair Sanders. And today, as the Chair mentioned, we're discussing the reauthorization of a bipartisan Pandemic and All Hazards Preparedness Act, or PAPA. Now, Congress, historically, we've done this in a bipartisan way, and I think it's a credit to the committee and to the chair and to the different members that we are continuing the tradition with this reauthorization. Specifically, Chair Sanders, Senator Romney, Senator Casey, and all my other colleagues, thank you for your work on this important legislation. It is our responsibility to make sure programs like this, critical programs like PAPA, are properly evaluated and improved and reauthorized, and I think we do this. My home state, my state, Louisiana, Senator Tuberville's state, we've actually had a role in this. PAPA was first enacted in 2006, reflecting the failures of the federal response to Hurricane Katrina. And PAPA seeks to support states and local governments and hospitals to be better prepared for future emergencies. To do this, it originally established the Office of the Assistant Secretary for Preparedness and Response, or ASPR, and the Biomedical Advanced Research and Development Authority, or BARDA. It made improvements to the Strategic National Stockpile so that vaccines, treatments, and tests would be readily available during an emergency. But we saw during COVID-19, the PAPA framework is far from perfect. Poor management and maintenance of the Strategic National Stockpile meant that doctors and nurses were forced to use expired personal protective equipment. Government bureaucracy sometimes enabled, but sometimes hampered, the private sector's ability to quickly launch tests at the beginning of the pandemic, and bureaucracy got in the way of clear communication between federal officials and the public. Now, although mistakes were made during COVID-19, we did learn some tough lessons, and we hope this legislation, it's here to make sure that future generations are not forced to learn on the fly should another crisis occur. We're updating the playbook, and we're ensuring that our framework remains flexible to address those future threats, a future Hurricane Katrina, for example. This legislation includes policies to increase accountability and to ensure that the tax dollar of my fellow Americans are used effectively. It improves transparency and promotes better partnerships with state, localities, and industry so each has the ability to better respond to a crisis. And it strengthens our ability to prevent and mitigate drug shortages focused on the type of shortages most likely to occur during an emergency. Lastly, the legislation strengthens the federal government's ability to invest in innovative technologies to respond to new and emerging threats. It is a major step forward in improving our readiness towards the next pandemic, natural disaster, the terrorist attack, or the accident that puts Americans' health and safety at risk. It also demonstrates what can happen when we work together on a bipartisan basis to reauthorize important legislation. I thank my colleagues for their collaboration. I look forward to today's markup.
Thank you very much, Senator Cassidy. We'll now turn to the legislation before us. We are hoping to take all votes in the 12 to 12:30 range to accommodate different committee schedules, and we'll keep members and staff updated. Similar to past markups, I would ask my colleagues to limit remarks to 2 minutes, and when recognized, specify the amendment number that you are offering and speaking on. I will now begin consideration of S2333, the Pandemic and All Hazards Preparedness and Response Act. Are there any members who wish to speak or offer an amendment to S2333? Senator Paul.
My remarks will take about 3 to 4 minutes. I would ask unanimous consent of 3 to 4 minutes on such an important subject.
Without objection.
I call up Paul Amendment number 1. For years now, nonpartisan scientists have been sounding the alarm about the proliferation of gain-of-function research that can potentially create superviruses with pandemic potential. Gain-of-function research occurs when a virus is manipulated in the lab to increase the strength of its contagiousness, literally causing it to gain a function. The supposed value of this type of research is to design countermeasures by modeling how viruses might mutate in the future. Although we do know that there is no historical precedent for any of this research leading to a vaccine in advance of knowing the pathogen. So while there's a hypothetical potential gain for doing this, we know of no real-life, real-world example of creating these superviruses that has actually led to a vaccine. We also know that now that we have mRNA technology, the speed with which we can make an mRNA vaccine, once we know the pathogen, can be done in literally days. Now that we've done it, really literally within days, we can create a vaccine. Because nature is random, if we are going to say, oh, we're going to create potential vaccines for what random mutation might come out, we would have to randomly guess the 1 in a million combination that comes from nature and sort of create vaccines in advance. The danger is this: when you mix and match these viruses, there's a possibility you come up with a combination so contagious or so dangerous that you end up with a virus that is 10, 20% lethal and is devastating to mankind. The Biden administration yesterday said they're not going to fund Wuhan, but they didn't say they're not going to fund gain-of-function research. Gain-of-function research has been funded in China now for over a decade. It was largely supported by Anthony Fauci and other supporters of gain-of-function research, but it went through our universities, it went to military research. There's a group called the Academy of Military Medical Research in China that's been on our intelligence community's watch list for a decade. We funded them. Went through UC Davis, went through UC Berkeley. All this happened. So while it's comforting to know that the Biden administration yesterday said they're not going to send it to the Wuhan Institute of Virology, that doesn't limit it from all the other entities in Wuhan that have gotten it: Wuhan University, Wuhan Agricultural University, Beijing. All of these different entities aren't limited by what the Biden administration did, and what the Biden administration is proposing to do is only limited by any administration changing their mind over this. So my amendment we voted on in Congress about a year ago, and it passed unanimously in the Senate. We attached it to the China subsidy bill and the chip subsidy bill, and then it was stripped out in the House, and it never became law. So this is an amendment that we'll vote on in a few minutes, or whenever we get to amendments, that passed unanimously. There was no Republican dissent, there was no Democrat dissent, and I hope we can do the same today. One expert, Kevin Esfeld of MIT, a developer of the CRISPR gene technology, wrote in the Washington Post that to discover many dangerous viruses or to learn to enhance weaker ones is to share the blueprints for an arsenal of plagues. I agree with him. In my opinion, it's nothing less than a death wish for the world. He talks about it being catastrophic and potentially civilization changing. So this is something that I think we should all come together on, and something that I think is incredibly important. If we were to learn any lesson from this, that even if there is a chance that this came from a lab, even if you believe there's any chance this came from a lab, we should not be funding this, particularly in a totalitarian country, and I hope we'll get a unanimous support from the committee.
Mr. Chairman.
Senator Casey.
Thank you, Mr. Chairman. I want to thank you as chair, and I want to thank Ranking Member Cassidy, Senator Romney, and so many others who work collaboratively on the working group to reauthorize this legislation, the Pandemic All Hazards Preparedness Act. I also want to thank the staffs, both Senate staff, on my staff, Sarah Maskornik, who did such good work, and so many others, as well as the Legislative Counsel's Office for all of their work on this legislation. The last 3 years, I think, have demonstrated over and over again to us how essential it is to plan, prepare for, and respond to a public health emergency. This act is the underpinning of that state and federal response, and has always been a very bipartisan endeavor. I'm pleased to once again be here to have a markup. This happens to be the 4th reauthorization of this law and the 3rd that I've worked on in the Help Committee. I strongly believe we must prioritize a timely reauthorization of these programs and authorities before their expiration to prevent a lapse in crucial services that ensure both public health and national security. While every title of the bill is important, I want to highlight 2 areas I've prioritized in the reauthorization. Number 1, addressing the needs of all groups of people, as well as strengthening biosecurity. The COVID-19 pandemic revealed the undue burden our most vulnerable populations experience during an unprecedented hazard like a pandemic. Without a strong voice in the planning of emergency response, children, seniors, and people with disabilities go unheard, and their specific needs are unmet. This undue burden to their health and quality of life is, of course, unacceptable. For this reason, I've made it my priority in the reauthorization to establish technical assistance centers that can assist communities in planning for disasters for seniors and people with disabilities. And I've also included a provision that would ensure states consider these populations when planning for future hazards. Mr. Chairman, I would ask consent for another minute and a half.
Without objection.
I've also included a section that addresses crisis standards of care that would require states to ensure any plans to distribute health resources and treatment during pandemics and emergencies do not discriminate against older adults and people with disabilities. An essential part of preparedness planning is the development of countermeasures, where our nation has already shown tremendous innovation. We must recognize that these pharmaceutical innovations also result in rare but concerning side effects for people. These Americans are using countermeasures like vaccines to benefit public health, and injury compensation programs are intended to provide them with the support they need after injury. Unfortunately, these programs are not functioning as they should, and Americans are suffering as a result. For this reason, I've proposed provisions that will improve the processing of injury claims. These Americans have waited too long for resolution, and we must respond to their individual needs. Finally, these remarkable innovations necessitate a research and development environment which values biosafety and biosecurity above all else. As we continue to learn about advances in biotechnology and their implications for the pathogens and agents that threaten the nation, we must evolve in how we manage those pathogens while still supporting research. As a result, I've codified the PAPARA authority for regional biocontainment laboratories. These labs across the country maintain constant readiness and surge capacity in the instance of a pandemic. Their work was pivotal in our response to COVID-19, and we should continue to provide them with the resources to be prepared for future threats. So, Mr. Chairman, I'm grateful for the work that everyone's done. We look forward to passing this bipartisan bill.
Thank you, Senator Casey.
Mr. Chairman?
Senator Romney.
Yes, I have enjoyed working with Senator Casey and his team, and also with the chairman and the ranking member on this legislation. It is an extensive piece of legislation, and it is designed to put in place some of the learning that we have as a result of the failures of our response to disasters, whether it was the pandemic or other natural disasters which have occurred. It's not perfect. I'm sure we'll have new lessons to learn as well. But I'm very pleased with a number of things. One, cutting off funding for research in China, particularly for gain-of-function research. I appreciate for the new focus on public-private partnerships. I appreciate the fact that we're giving states more flexibility to respond to natural disasters and to call in federal resources on a more accelerated basis. There are a number of things that are very much steps forward. I'm particularly pleased that we're going to have a better data collection system. I think a lot of us were frustrated that the only way we could get good data on COVID statistics was by going to Johns Hopkins. You'd think that maybe the CDC would have good data, but it didn't. So a number of these things we're trying to address in this legislation. I would note that while the four names I've mentioned as being associated with helping craft this legislation, I have failed to mention the fact that it is the staff that did 99% of the work. And they spent a lot of hours, a lot of sleepless nights. And I appreciate the great work on the part of my staff and the staff of the other members of this working team. It's been an extensive process. I think it's a step forward. I'm sure there are things we will wish we would have done better, but this, I believe, is an effort, a fair effort to learn from the experiences of the past. Thank you, Mr. Chairman.
Thank you. Senator Kane.
Mr. Chair, I want to thank you and Senator Cassidy for holding this bipartisan markup. I want to acknowledge both Senators Romney and Casey and everybody who's had a part of it. This is really important. Two issues that have been included at our request that I just want to highlight briefly is first some provisions dealing with long COVID. I've shared with this committee that I've been dealing with a very mild, thank goodness, but persistent neurological symptom from COVID for now nearly 3.5 years. And in talking about it, I have been able to hear an awful lot of stories of people who are dealing with much more serious challenges. And that's given me some motivation to try to provide some assistance. Earlier this year, I held a summit in Richmond together with long COVID patients and providers to talk about gaps in treatment and what we might do to better help these folks. The Agency for Healthcare Research and Quality joined me as sort of an organizer of the summit and an opportunity to learn from people and other administration officials and state and local officials as well. This bipartisan package includes provisions from my bill, the Care for Long COVID Act, to support AHRQ in its efforts to assure that healthcare providers have information going forward. Some of the work is already being done. What this bill does is codify it, and I appreciate the colleagues for including it. And second, public health data sharing. Having been a local official and a state official and now working here in the Senate, I've long been a champion of ensuring that our systems talk to each other. I think an awful lot of our healthcare data is in silos. Those are just the public silos, also private silos. And the better we share, the better we'll be able to be prepared to spot an epidemic or pandemic as it's coming, to look at the efficacy of treatments, the success of vaccines. And so sharing information, appropriately protecting patient information for their privacy is important. So I have worked with many colleagues here on the Improving Data in Public Health Act. This bill does not contain all of those provisions, but it contains a core of them, and I appreciate that and look forward to working with colleagues to do even more so that our public health systems have the data they need to keep people safe. Thank you, Mr. Chair.
Thank you, Senator. Further discussion? Senator Budd.
Yeah, Mr. Chairman, I want to thank Senator Markey and Senator Hickenlooper for working with me to see important provisions in this, included to prepare a public health response to address the misuse of AI and gene synthesis. In addition, I have an amendment to S 2333, PAPA, and I'd like to call up Bud number 1.
We're still on Senator Paul's amendment. We'll get to yours.
Fantastic, thanks.
Okay, yeah. Further discussions? Senator Marshall?
Yeah, thanks, Mr. Chairman. I want to speak in support of Senator Paul number 1's amendment as well. For over 20 years, this nation has funded viral gain-of-function research without any successes, without any gain. We've got nothing that's good that came from this viral gain-of-function research. But unfortunately, we saw this nuclear bomb go off and kill over 1 million Americans, over 10 million people worldwide. And like Senator Paul, I applaud that the White House has stopped funding the Wuhan Institute of Virology, but what they've not done is stop funding EcoHealth. EcoHealth is the one that funds the Global Virome Project, as well as Trinity Challenge. Those groups working hand in hand with the CCP and the Chinese military to develop terrorism, bioterrorism weapons. We need to stop funding any type of viral gain-of-function research, but especially with our adversaries. And I give Senator Paul's amendment my full support and appreciate him bringing it forward. Thank you.
Further discussion on Paul 1? Senator Cassidy?
I want to first thank Senator Paul because he's been the one who has been such an advocate for clarity as regards what NIH has funded and just to make sure that we kind of go through the, at times, obfuscation to figure out what it is. I'm also pleased to say that the underlying legislation gets at this not just as regards China, but as others that would be designated as a hostile entity. But Senator Paul's amendment adds specificity to this. And so I'm going to support his amendment, and I thank him for both his work in the past, but also his work on this amendment. We need to stop funding this sort of research by those who would be our adversaries. So thanks.
Thank you. Yeah, let me just say a word. First of all, Senator Paul today and in the past has raised this very, very important issue, gain-of-function research conducted in China and in other countries around the world. As we all know, bacteria and viruses that can be modified to cause pandemics are, as Senator Paul indicated, extremely dangerous. And that is why I worked with Ranking Member Cassidy to include a provision in this bill to make sure that any country, including China, that is deemed dangerous by our intelligence community would not be able to receive medical research dollars from the U.S. government for a minimum of 5 years. Senator Paul, I appreciate your attention to this matter. I am concerned, however, that if we pass this amendment, we would be jeopardizing international collaboration on the medical research that can lead to new discoveries such as flu vaccines. So I would ask my colleagues to oppose this amendment. But I do look, Senator Paul raises what is obviously a very important international issue, and I look forward to working with him on it. Senator Paul?
The wording that's been put into the underlying bill, I think, is a step forward. The reason why it might not work is this, and this is true of a lot of the ways we write legislation. It says that the DNI, the Director of National Intelligence, can designate countries to be adversarial nations and then place restrictions. What if the DNI doesn't place China on the list? What they are proposing to do right now, my understanding of the underlying legislation, it doesn't put China on some list. It lets the DNI decide to put them on a list. Yesterday, or this week, when the Biden administration came forward and said they're going to limit it to WIV, they're just limiting it to one. They don't mention gain of function. And so I think it's really a very, very small step forward and the potential that this goes on. I also wanted to add one point to what Senator Marshall said. For years and years, it has sounded very benign to identify viruses. So the Global Virome Project is to identify viruses. Before that was PREDICT. We spent $200 million, and probably most of Congress voted for it. It's like, identify viruses. That's going to be a great idea. We'll identify all the viruses and protect humanity from all the viruses. But there's two big problems with identifying all the viruses. Some of the viruses are maybe never going to interact with a human. They go down several hundred feet into a bat cave, they sift through a lot of guano, and they isolate viruses. And you say, well, what's wrong with that? Well, they're going into a very isolated area where man rarely goes, and they've checked the antibodies of the people who live around there, and very few of them have any antibodies to this at all. So these viruses aren't getting out of the cave. You're taking the virus out of the cave, and then you're taking it to a place like Wuhan of 15 million people. So you're taking it to a very remote area that has very little interaction between the bats and humans to a city of 15 million. So you're introducing a potentially dangerous virus into a big metropolitan area. You know, people have talked about how the subway system, you're 3 stops away from Paris in Wuhan. You get on the subway system a couple hundred yards from the Wuhan Institute, you take 2 stops and you're at the airport, and boom, you're in Paris the next time. One other quick point on this. So it's not only the identification and taking to a metropolitan area that's a problem. The second thing is, part of identification is they take the virus to the lab and they say, well, we've identified it, but what if we take part of this virus, the S protein, and stick it on another virus that we know, the old SARS, and let's see what happens. Now you've created a brand new virus. So included in the money we say is going to identification is actually money going to gain of function research. So I don't think the bill goes nearly far enough, and if people really are serious about doing something about the 1 million people who died, we need to vote for this amendment.
Mr. Chairman,
Yes.
just a couple quick comments. If sounds like it's going to go down, I didn't realize that it's going to get voted down. I would challenge this committee to have folks come in and educate us about the Trinity Challenge and what the CCP and Tencent are doing. And we talk about the opportunity with precision medicine. The Trinity Challenge is trying to figure out the genome of every person in the world and then be able to use precision medicine. The way that's set up, the Chinese are going to be way ahead of us, that we're not going to gain from that information. So I don't know why we keep turning over all of our technology, all of our great knowledge we have in this country over them. So I hope that we come back and visit this again.
And I'm prepared to do that.
Thank you.
I don't think there's any disagreement that this is an enormously important and potentially dangerous issue. All right, any other discussion on Paul 1? I'd like to keep moving. Next amendment, Senator Braun.
Thank you, Mr. Chairman. I have 3 amendments. I'm going to do them briefly, 2 to offer and withdraw, and start with accelerated drug approval for prescription therapies with Senator Paul. We've worked on this for some time. It would establish an accelerated approval pathway for drugs that are already approved in foreign countries with comparable regulatory agencies. Today, we're preparing for future emergencies. It only makes sense to have an expedited drug review process for safe and effective countermeasures that are already approved in developed countries. Our amendment would increase access to safe and effective drugs for Americans and drive down costs by increasing competition. Recognize that we do need to come to more of an agreement on this. Appreciate the fact that you're willing to discuss it. Withdraw it at this time, and hopefully we'll get to it here down the road.
This is an important amendment, and I do look forward we're going to be doing other legislation on prescription drugs. Let's see if we can work on this and deal with some of the problems in it.
Thank you, Mr. Chairman. Amendment number 2. This is with Senator Budd. During the COVID-19 pandemic, Americans saw government flourish while many of our constitutional rights were diminished. More and more, big government wants to turn everything into a national emergency. Recently, the Secretary of Health and Human Services stated that gun violence is a public health emergency. This would give HHS the ability to restrict Americans' right to keep and bear arms. HHS was never intended to implement gun control of any kind. My amendment with Senator Budd would simply prohibit HHS from declaring a public health emergency to implement gun control. And I am requesting a vote on this one.
Okay? Thank you. In my view, it is critical that we protect the authority of the Secretary of HHS to declare public health emergencies based on science and evidence. And this would be, I think, an unfortunate precedent, and I would urge my colleagues to vote no on this amendment. Senator Cassidy.
We've got a public safety issue. We absolutely want to reduce the incidence of gun violence. We need to give additional support to law enforcement. We've passed the Safer Communities Act on a bipartisan basis. But what we're talking about here is abuse of public health emergency powers. And if we continue to overuse, for the sake of expediency, something which is intended to be only for emergencies, not as in, my gosh, we've got a baseline of issues that we're addressing in a variety of ways, but no, because in an effort to kind of satisfy a political itch, the president's going to declare this an emergency, we're going to undermine support for the presidency, for the government, and for the concept of a public health emergency. I think this amendment's good. It addresses misuse of emergency powers by the president. If everything's an emergency, nothing is an emergency.
Further discussion? Senator Braun, you had another amendment?
Yes, I do. Thank you. This is with Senator Hassan. It's the equitable distribution of emergency medical countermeasures. I've worked extensively with her office and consulted with ASPR, getting their support as well. Additionally, my staff has worked with stakeholders to resolve any concerns with this amendment. It would ensure that HHS uses public health data when deciding how to allocate medical countermeasures during an emergency. It would also make public the data used to make an allocation decision, alongside a brief justification for the allocation. Everyone can agree that Americans deserve transparency into the decisions that HHS makes during public health emergencies. Chairman Sanders and Ranking Member Cassidy, I appreciate the collaboration from your staff on this as well. I will withdraw it, but I would like to request a commitment from both of you to Senator Hassan and me that you'll continue to work with us on this bipartisan, common sense concept going forward.
You got it.
Likewise.
Thank you.
Senator Markey, you had an amendment?
Yep. Thank you, Mr. Chairman. I'm going to be speaking on Markey Amendment number 1. And I am grateful that we could come together to protect our nation from the health security risk. I am especially appreciative of you, Mr. Chair, and the ranking member for including provisions on artificial intelligence. Thank you, Senator Budd, for your work on that issue. Gene synthesis and adding extreme weather to the National Health Security Strategy. This work will leave us better prepared for future threats to health security. However, I am concerned that this Pandemics and All Hazards Preparedness Act fails to do enough to address the climate crisis and guarantee protection for the workers on the front line of this crisis and every other health hazard. Toxic smoke from wildfires drives people into emergency rooms. The ongoing forest fires in Canada are like an exhaust pipe, sending these toxic fumes into the lungs of Americans. It's caused by climate change. 17 of the hottest recorded days ever happened this year. The latest dangerous example of extreme heat that causes heat stroke, pregnancy risks, and thousands of hospitalizations and deaths each year. Last week, a deadly flood brought months' worth of rain in only days, pummeling the Northeast, closing hospitals, contaminating water systems, and destroying thousands of homes. For example, water off the coast of Florida right now is nearly 100 degrees, which is only going to further supercharge hurricanes and other storms, causing unbelievable pain on families all across our country where those oceans are warming. It repeated as a pattern. We see it time and again: heat waves, wildfires, floods that drive people into emergency departments, close hospitals, leave a healthcare system that is already overburdened even further under-resourced. And in these dangerous moments, when the rest of the world shuts down, healthcare heroes show up. When the COVID-19 pandemic struck, supply chain and distribution failure led healthcare heroes to ration and, in some cases, fully improvise their own personal protective equipment. More than 3,600 healthcare workers lost their lives in the first year of the pandemic. Thousands more stopped working in healthcare at all because the burden we asked them to shoulder was too heavy for them and for their families. Here in Congress, we cannot forget the people who braved the front lines of pandemics, storms, wildfires, because people need care. We have a duty to deliver safe working conditions and a stronger voice to the workers and unions representing them. We have a duty to protect these workers and respond to the urgent crises facing our healthcare system. I submitted this amendment as a call to continue to work to meet this moment for our workers. The cost of the American people is too high to leave our healthcare system unprepared, but I understand that this amendment cannot pass at this time, but I will return to this subject because it's only going to grow as a crisis in our country. All of the symptoms are there. The planet is running a fever. The United States is running a fever, and there are no emergency rooms for planets or for countries. We have to make sure we give our workers and our institutions the help that they need. And with that, I ask unanimous consent to withdraw my amendment.
Without objection. Senator Budd, did you want to offer an amendment?
I did. So it's also to Papa, Budd Amendment number 1, please. So my amendment would eliminate gaps in managing the strategic national stockpile by developing a process to assess risk, set priorities, and measure progress in managing the stockpile. The amendment also creates a standard operating procedure for the agency to follow in managing stockpile purchasing while reducing unnecessary reporting requirements. I'd also like to thank Chairman Sanders, Ranking Member Cassidy for supporting this amendment, and Senator Hassan for co-leading this amendment. My understanding is that the amendment will go by voice, so I will not ask for a recorded vote. Chairman, I yield back.
Thank you. This amendment makes some important changes to the annual review process of the Strategic National Stockpile, and it's something that I support.
Mr. Chair.
Yes, Senator Hassan.
I just want to thank Senator Budd for his leadership on helping to strengthen the Strategic National Stockpile. To add to your comment, Mr. Chair, this is an important area of bipartisan work, and I look forward to continuing to work with Senator Budd and other committee colleagues on this issue, and I formally request to be added as a co-sponsor to Budd Amendment 1.
Without objection. Further amendments? Pardon me? Oh, yes, Senator Cassidy.
I thank you both. My gosh, one thing that the pandemic showed is that the management of the Strategic National Stockpile was like bordering on awful. GAO, General Accounting Office, made recommendations. You're implementing some of those recommendations. It's common sense. It's overdue. Thank you very much. I urge everybody to support.
Good. Senator Marshall.
Mr. Chairman, I'd like to call up Marshall Amendment number 1. This amendment is modeled after the Good Samaritan Health Professionals Act, bipartisan, bicameral legislation, what we co-led with Senator Angus King, and I thank him for his and his staff's great work. This bipartisan legislation provides medical liability protections to healthcare professionals, especially added protection when they go across state lines when providing voluntary care in response to federally declared disasters. While federal and state laws are intended to protect volunteer health professionals from unwarranted lawsuits, many inconsistencies exist, and it leaves clinicians vulnerable. I want to thank Senator Cassidy, all the members of the DOC caucus here on this side of the Capitol as well as on the House side that help us successfully advocate for a modified Good Samaritan to be included in the CARES Act. If you need a success story or a lack of success, I'd like to share mine. It's frustrating to me that I can go to Haiti or I can go to Central America or to Africa and be a Good Samaritan and use my skills as a physician, but when a hurricane strikes the United States, I cannot use those same clinical skills because I'm concerned about being sued. It's that simple. This provision takes away an important barrier that allows us to do that voluntary work, whether it's an epidemic or whether it's Mother Nature. It's widely supported by clinicians and their employers, and I'd note that even our House colleagues support it. It passed out of the House Energy and Commerce Committee before under unanimous consent. Again, I want to thank Ranking Member Cassidy for working so closely with us on this legislation. You've led this legislation in the past, and I'm honored to pick up this baton and carry it forward. Unfortunately, I have to withdraw this amendment, as we could not reach bipartisan agreement. I can't tell you what a huge disappointment it is to the doctors' groups who have reached out to me, specifically the neurosurgeons, my orthopod friends, the urologists, general surgeons, who would all love to do voluntary work across state lines when disaster strikes. Thank you, and I yield back.
Let me say to Senator Marshall, he raises an important issue, and I want to work with you, and I think we can resolve it. All right, but not right today. Further amendments. Senator Paul, good.
This is Paul Amendment 2. Okay. Ask unanimous consent to speak up to 5 minutes.
Okay.
When the
Reluctantly given.
When the government's COVID lockdowns triggered nationwide layoffs, causing some businesses to close for good, the CDC decided that instead of letting people go back to work so they could pay their rent, it was a better idea to take the unprecedented action of suspending every residential rental contract in America. The law that the CDC cited as authority to do this was written in the 1940s to quarantine people who might spread certain dangerous contagious disease. The law contained a catch-all phrase, and other measures, as in his judgment may be necessary for the CDC director. They said, so he should quarantine people for certain infectious disease and whatever else he determines is necessary. And so the Biden administration interpreted that to mean, well, actually first, I guess the Trump administration interpreted it to mean you don't have to pay your rent because you can be limited and you can be quarantined and whatever else the CDC director wants. Well, the court struck this down as ridiculous. They said this is the worst abuse. In fact, they were warned, in fact, and the Biden administration went through it anyway. But the Supreme Court rebuked this overreach and stopped the enforcement of this order in an opinion that said the plaintiffs were virtually certain to succeed on the merits of their argument that the CDC exceeded its authority. This unfortunate overreach occurred because of vague language in a 1940s quarantine law. My amendment would effectively codify the Supreme Court's ruling by removing this vague language and stop future abuses of the law. It simply strikes the catch-all phrase in the statute to make clear that the CDC's quarantine authority is for public health, not rent control. This clarification is needed now more than ever because our new CDC director, who won't be subjected to Senate confirmation until 2025, has a history of supporting strict lockdowns and mandates. The current CDC director in her last job as North Carolina's Secretary of Health and Human Services, Dr. Mandy Cohen, said schools with students in K to 8th grade should require all children to wear masks indoors regardless of vaccine status. Now, you might think this comment was made at the beginning of the pandemic. No, she made this comment in July of 2021, more than a year and a half after the pandemic began, after we already had a mountain of evidence to show that elementary-age kids were at least risk from this virus. Do we want to give an unelected official such wide discretion to use emergency powers as any other measures, as in her judgment, may be necessary? What a terrible piece of legislation, when she has a record of supporting mask mandates on 6-year-olds, even after the evidence has shown that it's not effective. I offered this exact same amendment last year, and it was supported by 10 members of this committee. I hope everyone will support it, and then we'll do so again, and I urge a yes vote.
I think Senator Paul's amendment highlights how far CDC has strayed from its core mission. To kind of, use the same sort of phrase I used earlier. If CDC's mission is everything, then its mission is nothing. It needs to be focused upon that which is truly public health as opposed to effectively regulating an economy. So I'm asking all to support Senator Paul's amendment.
Following up on that same topic, I offer up my amendment number 1 for.
I'm sorry, we're still on Paul 2.
Okay, go ahead.
I'm sorry. Senator Paul's amendment limits the scope of HHS to control infectious diseases by prescribing the actions that the Secretary can take rather than allowing the Secretary to use his or her judgment to prevent the introduction, transmission, or spread of infectious diseases. For that reason, I'll be voting no. Urge a no vote. Further discussion on Paul 2. Seeing none, Senator Tuberville, do you have an amendment?
Thank you. I'd like to offer my amendment for consideration. Number 1, I'm asking there be a roll call vote on this amendment. Last year, this committee considered the prevent pandemic legislation. As part of this legislation, I worked with committee leadership to ensure that a specific provision was included. That provision would make the CDC director a Senate-confirmed position. The provision was ultimately included in that package, which passed out of this committee 20-2. That section of the prevent bill was then included in a year-end spending package. However, the version of the language that was signed into law made the provision effective in 2025, not immediately upon the date of enactment of the law. My amendment today would be keeping with the intent of what this committee voted to pass last year and make the CDC director subject to Senate confirmation immediately. We deemed this decision important enough to pass it out of this committee on a widely bipartisan basis back then, and I believe we should do the same today. Americans have truly lost so much faith in the CDC as an institution, and one of the best things we can do to set us up to defeat a future pandemic is to give Americans a voice when it comes to leadership as such an important agency. I urge my colleagues to support this when it comes to a vote.
Discussion. As we all know, last year, the Omnibus Appropriations Bill included a provision to require Senate confirmation of the CDC director beginning in January 2025. This amendment would move that date up immediately. Given the fact that the Senate seems to be spending virtually all of its time voting on nomination after nomination after nomination, while others, I strongly oppose this amendment. We will deal with it in the next year. Yeah, Senator Cassidy.
Again, it reflects a wildly bipartisan vote. But I'll also point out that, boy, weren't people disappointed with the CDC last time? Isn't there a need to have more oversight? This just adds the ability for us to provide oversight more quickly. And I think that should be a kind of goal of this committee. So with that, I urge support for the amendment.
I would just say on this whole thing, were we disappointed with the CDC? Yeah. Were we disappointed with the Trump administration? Yeah. We were hit with a terrible, terrible pandemic, and I hope we don't beat up too much on public health workers who at that time did the best that they could.
Can I reply to that?
Sure.
Yeah. So I'm not beating up on public health workers, but when a mission of an agency becomes so diffuse that it can't focus on its mission, that's a problem.
Yeah.
And I've just met with Dr. Cohen, and she seems committed to again, sharpening focus. But it's up to us. Ultimately, we're the ones responsible because we allowed them to lose their focus. We need to change that. And I think Senator Tuberville's amendment is a ways to go to change that.
Senator Paul?
I support the amendment, and I think that it's important to know how much disinformation came out of the CDC and why we need to have more scrutiny of who we appoint to the CDC. For one, probably the #1 piece of disinformation that came from the CDC is that natural immunity doesn't account for anything and isn't worth evaluating. For about a year, we had no vaccine. If you wanted to save lives in the nursing homes, the one thing you could have done was hire people and put people in charge of those in nursing homes who have already recovered from COVID. Had they done that one simple step and advised that from a public health point of view, we might have saved thousands of lives. Instead, we had public health officials in New York take people who were positive from COVID and stick them back in the nursing homes. And then we also had people coming in and out of the nursing homes and the hospitals who weren't immune to this. So the discounting of natural immunity was a great problem. One of the biggest problems that also came from the CDC was in the early stages of the testing. And this has direct policy ramifications, and I brought this up before, and we don't have an amendment for it today, but the testing idea, when the CDC decided, under the Trump administration, but these are just permanent bureaucrats, I don't think they're Republican or Democrat, but they made the decision to monopolize the testing. And they disallowed and said any university that had a test would have to get an emergency use authorization. This is still sort of the policy, and it morphed for where you used to have thousands of universities across the United States simultaneously developing tests and very quickly getting them to market. In this case, the University of Washington had a test for COVID within 3 days that worked. He tried to get it approved by the CDC, and they said they needed a hard faxed copy, and his response was, "What's a fax?" You know, I mean, then they said, "Oh, no, you need more testing with the COVID virus." And he says, "Well, you send me some samples." And they said no. But he had a working test within 3 days. He's a PhD virologist. He's a very accomplished doctor at University of Washington. But the CDC monopolized it. We still have this question out there for testing. Should we let universities do testing? There's all kinds of questions. Does plexiglass work? You know, if you put plexiglass in front of you, does that slow down the spread of the virus? Do air filters work? Do masks work? Does social distancing work? What are the studies on each side? Do air filters work? We haven't done any of those. We haven't had hearings on any of the policies that came out of the CDC to see whether they worked. But we do know that the CDC promulgated studies that tried to obscure natural immunities, promulgated studies that tried to obscure that the vaccine really didn't stop transmission. So all these questions are important. It's exactly why we should have the CDC nominee come forward, and we ought to have this discussion before it happens. We claim that we care about the million people died, but we've done almost nothing to evaluate whether the policies of the CDC helped, hurt, or whether the same amount of people died no matter what they did to try to get involved.
Okay. Further discussion. Other amendments? Senator Paul.
I'd like to bring up Paul Amendment 3. The National Institute of Allergy and Infectious Disease grew by billions of dollars after 9/11. So it used to be the NIAID was 1/17 of NIH. It became the dominant. All the money went to them. Why? Because they began getting defense money, and they began getting money discussing bioweapons. And a lot of this was after the anthrax scare that came right after 9/11. So it grew and it grew and it grew till the most important person over there turned out to be one person, Anthony Fauci. People didn't even know the name of Francis Collins, who was head of the NIH, because the head of the NIAID became more important than even the head of NIH. Anthony Fauci's reign turned out to be decade after decade, and he accumulated power after power. And I think it's true what Lord Acton said, that power is directly related to corruption, that power corrupts and absolute power corrupts absolutely. When J. Edgar Hoover died in 1972, he had been director of the FBI for 37 years. When he started in that post, the Air Force wasn't yet a separate branch of the armed services. By the time Fauci's tenure ended, Neil Armstrong had walked on the moon. It seems that a shocking amount of time for one man, actually that was still when Hoover's tenure ended. If that seems that a shocking amount of time for a man to control an agency, just consider that Dr. Anthony Fauci was head of NIAID for over 38 years. Yet in all those years, the Senate never once voted to confirm him because the law didn't require it. By the time he retired, Dr. Fauci was the highest paid official in the entire government, being paid more than the president. Imagine how much change in the world happened while Fauci was in government. In 1984, the internet was only 1 year old, and Steve Jobs had just released the first Apple PC. It weighed over 16 pounds. From that time until last year, Dr. Fauci was the head of the most powerful institute in the NIH. The jurisdiction of the NIAID covers everything from asthma to Ebola, from peanut allergies to the plague. From the head of that institute, Fauci installed himself as a de facto pandemic czar, advocating for big government policies like mandatory vaccines for school-aged children, even though young children were the least at risk for bad outcomes from COVID-19. My amendment will make sure that no one person can hold that job for generations without accountability. It divides the NIAID into 3 separate institutes, one for allergic disease, one for infectious disease, and one for immunologic diseases. This will better align with NIAID's stated mission to better understand, treat, and ultimately prevent these 3 types of diseases. The directors of the 3 new institutes will be appointed by the President, confirmed by the Senate, and serve no more than 2 5-year terms. This kind of reorganization is nothing new. As recently as 2012, Congress eliminated one center at the NIH and replaced it with a new one. If we've learned anything from the COVID pandemic, it's that the time has come to restructure NIH again, and I ask for your support.
Discussion. I do believe that we need to make some changes at the NIH, but eliminating the National Institute of Allergy and Infectious Diseases and adding more institutes, more directors, and more Senate confirmations is not the way to get those changes done. I urge my colleagues to vote no. Senator Cassidy.
I agree totally with Senator Paul's goal of holding federal agencies accountable, but I have concerns how the amendment will effectively grow government and break the NIH up into other silos. And I will oppose this on two reasons. One, I think regulating the exception, in this case, the longevity of Dr. Fauci's and his role in the pandemic, creates bad law. You go after the one, but it applies to everybody, and then it's just the exception should not dictate our laws. Secondly, I oppose it on a scientific basis. As it turns out, underlying immunologic mechanisms are critical when it comes to understanding COVID, but also in understanding allergy, but also in understanding immunologic disease. And in some cases, the treatment for a condition in one category is the same treatment for conditions in the other two categories. So I think there's a synergism there which we should acknowledge, and breaking them into three would create that lack of synergistic research. So for this, I intend to vote no on the amendment.
Okay. Further amendments. Senator Paul.
I call up Paul Amendment number 5 and ask unanimous consent to be able to speak up to 5 minutes.
Without objection.
Some employees of the federal government, particularly employees of the NIH,
Excuse me, Senator Paul. What's the problem?
5.
Is this number? Is this 4 or 5?
5. Some employees of the federal government, particularly employees of the NIH, are receiving royalties, which may be paid by companies that have business before the agencies that oversee them. Without this amendment, taxpayers and Congress itself are left in the dark when trying to assess conflicts of interest. According to Open the Books, who sued for the information and received redacted documents, about 2,400 NIH scientists received more than $300 million in royalty payments during the last decade. That's an average royalty payment of $135,000 per scientist. But NIH redacted key details, and we don't know who is making the payments, how much each payment amounted to, or why the payment was made. Even Dr. Fauci, who received at least 24 royalty payments through 2021, refused to tell Congress what he received in payments or whether anybody on the vaccine committees were receiving royalties from the vaccine manufacturers. We know how much his salary was, over $400,000 a year, but to this day we don't know who paid Dr. Fauci in royalties or how much they paid him or even what they paid him. We do know that he received over $1 million from a nonprofit. It's kind of extraordinary that members of government, members of Congress, I think, are forbidden from taking more than $25, and yet a lead bureaucrat that controls so many billions of dollars was allowed to be given $1 million while still working for the government. Shouldn't we care about conflicts of interest? Shouldn't we stop and think that perhaps the people that dole out government grants will be tempted to reward these companies that pay them royalties? The time for royalty transparency is long overdue, and I ask for a yes vote on my amendment.
I personally am not unsympathetic to the goal of Senator Paul and look forward to working with him. Big money exerts a huge influence on everything that we do here, and I think we should look at it. Unfortunately, we have consulted the parliamentarian, and it is my determination based on that recommendation that Paul Amendment number 5 related to financial disclosures of executive branch employees is outside the Help Committee's jurisdiction and violates Rule 15 of the standing rules of the Senate. Accordingly, I rule it out of order.
Mr. Chairman?
Yeah.
I'd like to make a motion similar to the motion that you will make later on in this hearing to modify amendment to make it under the jurisdiction of this committee.
Say that again.
Senator Paul, repeat your request.
I would like to make a motion that is essentially identical to the motion you will make in a few minutes to modify one of your amendments. And that motion is to modify my amendment, and I have it here at the desk and we can distribute it, to modify amendment to make it germane to the committee, and therefore it would then be eligible for a vote.
You're not making a motion to modify the amendment.
No, I don't think that's correct, Senator Paul. That's not what we intend to do.
And
Well,
And you're
I've
outside.
made a motion, I am making a motion to modify my amendment to make it consistent and germane with the jurisdiction of this committee.
The Help Committee has historically ruled second-degree amendments out of order, and I will follow that practice.
Is it not true that you're going to make a motion later in this committee to amend the manager's package in such a way that was not announced to the committee previously and will be new to the committee as you announce it?
Yes, we are going to make a motion to give staff technical and conforming authority.
We are going to make a motion, which is not uncommon, to ask the staff to make technical changes.
And we are
Well, no, I think it's more than technical changes. It's,
sections because of CBO scoring.
And we're going to strip sections because of CBO scoring.
yeah, but the thing is that you're doing that not with the deadline of amendments. You're now doing that after the amendments, but you're ruling mine out of order because I'm after the deadline for enrolling my amendment. If I had done this amendment on Friday, it would be eligible.
No,
You're now
we're-
going to do an amendment. You're going to modify the process by
we're
amending the
ruling-
bill.
Rand, we're ruling
Something that
your
wasn't
amendment out of order because it's outside of the jurisdiction of the committee.
Right, and I'm asking to modify the amendment, and you're saying that I can't do that, but you're going to modify the bill in a like fashion.
Not in a like fashion.
Well, you are. You're going to reduce a significant part, or take a significant part of the bill out of the bill, and that was not announced by the deadline. You're doing it after the fact. So there's going to be one set of rules for you and another set of rules for everyone else.
Bipartisan fashion, yes, we have consulted in a bipartisan way. We're going to make a motion and we will, yes. correct.
In a bipartisan way, we are going to proceed.
But then in that case, I would make a motion to overturn the ruling of the chair on the germaneness of my bill and request a recorded vote.
Senator Paul has appealed the ruling of the chair that his amendment number 5 lies outside the jurisdiction of the Health Committee. We will take a vote on whether the decision of the chair should stand. A yes vote means you are voting to uphold the ruling, and a no vote means you are voting to overturn the ruling, and I will certainly be voting yes. You want to do the vote?
Yep.
Mr. Chair, we don't have a quorum right now.
All right.
All right, then we will postpone that vote. One sec, please.
We have 7.
We do have, apparently, we do have a quorum. Want to take a recess for a few minutes?
Sure.
All right, let's take a brief recess,
Subject to the call of the chair.
subject to the, we'll stand in recess, subject to the call of the chair. Okay. We have a quorum. Senator Paul has appealed the ruling of the chair that his amendment number 5 lies outside the jurisdiction of the Help Committee. We'll take a vote on whether the decision of the chair should stand. A yes vote means that you are voting to uphold the ruling, and a no vote means you are voting to overturn the ruling. I urge a yes vote. The clerk will call the roll.
Senator Murray?
Aye by proxy.
Senator Casey? Aye. Senator Baldwin?
Aye by proxy.
Senator Murphy? Aye. Senator Kane?
Aye by proxy.
Senator Hassan? Aye. Senator Smith?
Aye by proxy.
Senator Lujan?
Aye by proxy.
Senator Hickenlooper? Aye. Senator Markey?
Aye by proxy.
Senator Cassidy?
Yes.
Senator Paul?
No by proxy.
Senator Collins? No. Senator Murkowski?
Yes, by proxy.
Senator Braun?
No by proxy.
Senator Marshall? Senator Romney? Senator Tuberville?
No by proxy.
Senator Mullen?
No by proxy.
Senator Budd?
No by proxy.
Chairman Sanders?
Aye.
I have 14 ayes, 5 nays.
The ayes have it. Senator Hickenlooper, I think you have an amendment.
Yes, thank you, Chair Sanders and Ranking Member Cassidy, for your work on this legislation to help us better prepare for the next pandemic. We know that a pandemic is going to come. It's just a matter of time. But steps like those in this bill today are necessary to save lives and protect our economy when that next pandemic does come. In that spirit, I offer this amendment, the Emerging Pathogen Preparedness Program Authorization Act, along with Senator Budd, to allow for the creation of a new program at FDA specifically dedicated to the review of medical countermeasures for emerging pathogens. This new team will allow FDA to dedicate the necessary manpower to be able to quickly evaluate and clear what we hope, can only hope, many countermeasures that will come before them during a pandemic. Getting these countermeasures to the public fast in a time of crisis will save lives. As you know, the FDA is eager to have this team authorized. They requested this specific authority earlier this year. I think if they felt they could do it without this bill, they would do so. FDA believes that this authority will allow them to be better positioned to respond to emerging pathogens in a quick and agile way. We know the cost of doing nothing is too high. One estimate found that it was that the overall cost was as much as $500 to $800 billion per year during a major pandemic. So we have to be prepared. I'd like to thank Senator Budd for his partnership on this effort to strengthen our federal response to future pandemics. I would also like to give my thanks to Chair Sanders and Ranking Member Cassidy for working closely with our office to include language on gene synthesis safety and security in this underlying bill, which I'm happy to support today. I'm glad to sponsor this amendment and urge a yes vote from my colleagues on the committee.
Thank you, Senator Hickenlooper. I want to thank you and Senator Budd for offering this amendment. This amendment would create an emerging pathogens program at FDA so that the agency can better respond to new threats. This program will help us advance scientific research and move quickly to review new vaccines, and I would urge a yes vote on this amendment. Senator Cassidy?
I thank Senators Budd and Hickenlooper for their work on this amendment, and ensuring quality review of medical countermeasures is important for readiness against future threats. But it's unclear because we already have, it's unclear why we should be creating a new program for countermeasures within a single center at FDA. FDA already has an Office of Counterterrorism and Emerging Threats, or OSIT, that works on countermeasure-related issues. And so I'm not sure that we need to create a new program at CBER, and for that reason, I will oppose.
Okay. Are there any other members who wish to speak or offer an amendment to S 2333? Seeing no other discussion that would end debate on the bill and amendments, we will plan to come back at noon. Members were told to come back at noon, and when we come back, we will vote on the amendments and final passage. The committee stands in recess until noon, subject to the call of the chair. We're back in business. I note the presence of a quorum, and we'll now move to votes on the amendments and final passage of S 2333. We will take votes in the order that we considered the amendments. We'll now vote on Paul Amendment number 1. The clerk will call the roll.
Senator Murray,
No by proxy.
Senator Casey, Senator Baldwin,
No by proxy.
Senator Murphy,
No by proxy.
Senator Kane, Senator Hassan, Senator Smith, Senator Lujan,
No by proxy.
Senator Hickenlooper, Senator Markey,
No by proxy.
Senator Cassidy,
Yes.
Senator Paul,
Yes, by proxy.
Senator Collins,
Yes, by proxy.
Senator Murkowski, sorry,
Yes, by proxy.
Senator Braun,
Yes, by proxy.
Senator Marshall,
Yes, by proxy.
Senator Romney,
Yes.
Senator Tuberville,
Yes, by proxy.
Senator Mullen,
Yes, by proxy.
Senator
Yes,
Budd,
by proxy.
Chairman Sanders.
No.
I have 10 ayes, 11 nays.
The noes have it, and the amendment is not agreed to. We'll now vote on Braun Amendment number 2. Clerk will call the roll.
Senator Murray,
No by proxy.
Senator Casey, Senator Baldwin,
No by proxy.
Senator Murphy,
No by proxy.
Senator Kane, Senator Hassan, Senator Smith, Senator Lujan,
No by proxy.
Senator Hickenlooper, Senator Markey,
No by proxy.
Senator Cassidy,
Yes.
Senator Paul,
Yes, by proxy.
Senator Collins,
Yes, by proxy.
Senator
Yes,
Murkowski,
by proxy.
Senator Braun,
Yes, by proxy.
Senator Marshall,
Yes, by proxy.
Senator Romney, Senator
Yes, by
Tuberville,
proxy.
Senator Mullen,
Yes, by proxy.
Senator
Yes,
Budd,
by proxy.
Chairman Sanders.
Nope.
I have 10 ayes, 11 nays.
Noes have it, and the amendment is not agreed to. Now we'll take a voice vote on the Budd Amendment 1. All those in favor say aye.
Aye.
Aye. All those opposed say no. The ayes have it, and the amendment is agreed to. We'll now vote on Paul Amendment number 2. The clerk will call the roll.
Senator Murray,
No by proxy.
Senator Casey, Senator Baldwin,
No by proxy.
Senator Murphy,
No by proxy.
Senator Kane, Senator Hassan, Senator Smith, Senator Lujan,
No by proxy.
Senator Hickenlooper, Senator Markey,
No by proxy.
Senator Cassidy,
Aye.
Senator Paul,
No by proxy. I mean, yes, yes, by proxy.
Senator Collins,
Yes, by proxy.
Senator Murkowski,
Yes, by proxy.
Senator Braun,
Yes, by proxy.
Senator Marshall,
Yes, by proxy.
Senator Romney, Senator Tuberville,
Yes, by proxy.
Senator Mullen,
Yes, by proxy.
Senator Budd,
Yes, by proxy.
Chairman Sanders.
No.
I have 10 ayes, 11 nays.
We'll now vote on Tuberville Amendment number 1. Clerk will call the roll.
Senator Murray,
No by proxy.
No by proxy.
Senator Casey, Senator Baldwin,
No by proxy.
Senator Murphy,
No by proxy.
Senator Kane, Senator Hassan, Senator Smith, Senator Lujan,
No by proxy.
Senator Hickenlooper, Senator Markey,
No by proxy.
Senator Cassidy,
Aye.
Senator Paul,
Yes, by proxy.
Senator Collins,
Yes, by proxy.
Senator Murkowski,
Not voting.
not voting, Senator Braun,
Yes by proxy.
Senator Marshall,
Yes by proxy.
Senator Romney, Senator
Yes by
Tuberville,
proxy.
Senator Mullen,
Yes by proxy.
Senator Budd,
Yes by proxy.
Chairman Sanders.
No.
I have 9 ayes, 11 nays.
The noes have it, and the amendment is not agreed to. We'll now go to Paul Amendment number 3. Clerk will call the roll.
Senator Murray,
No by proxy.
Senator Casey, no. Senator Baldwin,
No by proxy.
Senator Murphy,
No by proxy.
Senator Kane, Senator Hassan, Senator Smith, Senator Lujan,
No by proxy.
Senator Hickenlooper, Senator Markey,
No by proxy.
Senator Cassidy,
No.
Senator Paul,
Yes by proxy.
Senator Collins,
No. By proxy.
Senator Murkowski,
No by proxy.
Senator Braun,
Yes by proxy.
Senator Marshall,
Yes by proxy.
Senator Romney, Senator Tuberville,
Yes by proxy.
Senator Mullen,
No by proxy.
Senator Budd,
Yes by proxy.
Chairman Sanders.
No.
I have 5 ayes, 16 nays.
The noes have it, and the amendment is not agreed to. We'll now vote on Hickenlooper Amendment number 1. The clerk will call the roll.
Senator Murray,
Aye by proxy.
Senator Casey, aye. Senator Baldwin,
Aye by proxy.
Senator Murphy,
Aye by proxy.
Senator Kane, Senator Hassan, Senator Smith, Senator Lujan,
Aye by proxy.
Senator Hickenlooper, Senator Markey,
Aye by proxy.
Senator Cassidy,
No.
Senator Paul,
No by proxy.
Senator Collins,
Not voting.
Senator Murkowski,
No by proxy.
Senator Braun,
No by proxy.
Senator Marshall,
No by proxy.
Senator Romney, Senator Tuberville,
No by proxy.
Senator Mullen,
No by proxy.
Senator Budd,
No by proxy.
Chairman Sanders.
Aye.
I have 11 ayes, 9 nays.
Just this
I move to authorize staff to make any required technical and conforming changes when preparing S-2333 and to address scoring information received last night from the Congressional Budget Office to remove subsection A of Section 302, subsection B of Section 303, and subsection B of Section 609. All those in favor, please say aye.
Aye.
Aye. Those opposed, say no. The ayes have it, and the motion is agreed to.
So hold on, we have to hold on this. We need to change Mr. Wood's vote on Hickenlooper to yes.
We're changing, apparently, Senator Budd's vote on Hickenlooper from no to yes, as I understand it.
Good.
Okay, let's do that.
Oh, my bad.
We're going to have to recess till we get more people here.
All right, we're going to have to take a very short recess until we,
Follow the chair.